we have to concentrate on if there is any problem within that plant. If we go here, this one, we can see that there are something growing there, okay? And who will notice that? A good primary healthcare physician with a good background. And if he leaves that, this will become like this. It will distort the whole plant. So that's the problem there. That is the early diagnosis, which you leave a problem growing, so it distorts the whole health of the person. Any problem, any medical problem starts very tiny, undeductible, unseen, and if it is left, it will create a problem. It's just like a flower seed. It starts with a seed, then it grows and makes a plant, and that plant grows to become like a tree. So if we leave it, when it becomes a full-grown tree, how do you remove it? Either you cut it, and then you will leave the roots down there, causing all the problem, or you bring a crane and pull it, and then you will cause distortion of the whole place. While as a family physicians, if you have a continuity of care and you know about the patient and his family and what could be the problems that is arising in that family, you could easily, when it's grown, you remove it with your 2 hand fingers and prevent all the complication that occurs. The other thing is the wide vision. Family physicians, they have wide vision about any illnesses that develops. So this one is a lady who brings her child. He has fever, running nose. You may think that it's an upper respiratory tract infection. Then you give the simple treatment. The next day, they come with these white spots on the gum. So what's it? Anybody?
Complex spots.
This is complex spots, which is the early manifestations of measles. And if you leave it, the child will develop this. And then after a few days, he might go into this with respiratory failure. We know that there is no treatment for measles, but you can do a good preventative measure to avoid this child from going into this problem. And moreover, when you work in the primary healthcare center, you work alone. You don't have support. You don't have people who are supporting you if you do mistake. Not like in the hospital when you work, there is the senior physician, there is the consultant who are around you. So if you make a wrong decision, they will help you. Here you have to have a strong root to stand, like this tree. If you don't have that strong root, you will fall. And then it's very cost effective. When we mentioned about cost effectiveness, and Dr. Omar mentioned about cost effectiveness, let me show you 2 studies which I have. One study I have done in Bahrain, and the other I compared it to UK. And you can see a health center visit costs around $14 to $20. While if it goes to hospital OPD, it will cost $130, which is around 600% more. And if there is an admission, it will go to there. And if there is an admission to intensive care, that will be the cost. And it's more or less similar in the UK. So you can see the difference in the cost between treating the patient in the primary health care or in comparison to treating them in the secondary care. Let me give you an example. A cardiac bypass surgery. Anybody would know how much does it cost? In the range? And there are many of them which is being done nowadays. So cardiac bypass surgery in Saudi Arabia, it will cost around $25,000 to $45,000. In UAE, 22. The lowest is in Iran, $6,000. However, this cardiac bypass surgery, you could have prevented it by good screening in the beginning and preventative program. And this is a study which has been done. It shows that typical cost in prevention, which is around over 20 years, it will cost around only $5,000. While surgery in the USA, it costs $70,000 for that people. So the cost effectiveness, there is a very good cost effectiveness, and you have a high saving in money if you prevent this problem from occurring. Prevent smoking, we have seen about obesity yesterday, prevent diabetes, help in prevention of complication of non-communicable diseases. And the economic benefit, there is much of economic benefit. Of course, the cost effectiveness will be reflective on the whole budget of the Ministry of Health. Each $1 spent on prevention is equal to $7 spent on curative care. See how much it is, 700% increase. Primary health care improves the performance of health system by lowering overall healthcare expenditure while improving the population health and access. With regard to hospitalization, does it affect primary health care? Good primary health care, yes. And you can see these studies which has been done. It shows that people with good primary health care, they have lower admission to hospital, and that is in both countries, I mean in European countries and in developing countries as well.